Hi, everyone. My name is Carter, a Master's of Public Health student in the School of Public Health and Social Policy. I want to acknowledge that I'm calling in today from so-called New Westminster, situated on the ancestral and unceded shared territories of the Kwantlen and Kikite First Nations. My practicum experience this semester was spent working alongside the Indigenous Cultural Safety Department at the Fraser Health Authority in their main office in Surrey, BC, specifically with the research and evaluation team supporting their day-to-day work. Today, I would like to present to you my main focus of the practicum, which was developing an evaluation proposal for the newly launched Indigenous Caregiver Support Model pilot program. Before I begin, I would like to acknowledge that Fraser Health provides care on the traditional, ancestral, and unceded territories of the Coast Salish and Inclipamuk First Nations, and is home to 6 Métis chartered communities. For background knowledge, in Fraser Health's Fraser East region, with its 317,555 residents and 23,920 Indigenous individuals, including diverse populations from 32 First Nations communities, 6 Métis chartered communities, and those living away from their home communities, there's a vast representation of Indigenous peoples that call this region home. According to recent data, 7.7% of Indigenous people in BC are aged 65 and older, with half of Indigenous elders in Canada experiencing frailty symptoms, emphasizing the growing demand for specialized healthcare and home care support. From a healthcare system level cost perspective, a standard hospital admission in BC is $8,430, and an annual long-term care bed costs $57,600. On a more personal level, 96% of home care recipients in Canada rely on unpaid caregivers who face personal and financial challenges due to their caregiving obligations. And recognizing these issues, there is a need to enhance caregiver support and integrate Indigenous perspectives into home-based care, aiming to support elders aging at home in their home communities, support community caregiving continuity, and reduce healthcare system costs. The Indigenous Caregiver Support Model, or ICSM, launched in December 2023, is a pilot program supporting up to 20 homebound individuals in Fraser East, in partnership with Stalo Nation. This model prioritizes culturally safe care by integrating Indigenous wellness principles and fostering collaboration among caregivers, homebound individuals, and community members. The program supports the growth of caregiver skills through guidance from a dedicated team, including a clinical resource nurse, CRN, and 2 licensed practical nurses, LPNs. Financial support is provided through a daily stipend to caregivers to support the caregiver financial challenges faced, aiming to support their longevity and care provision. The ICSM aims to reduce unnecessary hospitalizations and emergency visits by offering a support system, emphasizing community connection and personal engagement for homebound seniors' well-being. To kick off the evaluation process, I completed an environmental scan using databases such as iPortal, Medline, CINAHL, Web of Science, PubMed, and social work abstracts, supported by a UVic librarian to assess existing similar programs in order to inform our evaluation process. The scan revealed a lack of resources similar to the ICSM program, highlighting the uniqueness of this program. However, a Gray literature search did identify 2 relevant programs for evaluation guidance: the Better at Home program and the Aging Well at Home program. The Better at Home program provides non-medical services to Indigenous elders in BC communities, emphasizing cultural adaptation and community engagement in its evaluation. Services include transportation assistance, housekeeping, yard work, friendly visiting, grocery shopping support, and minor home repairs. The evaluation employed culturally sensitive methods like interviews, circle sessions, surveys, and Indigenous data ownership principles. The Aging Well at Home program, led by the Jewish Family and Children's Service of Greater Boston, supported seniors in Brooklyn, Massachusetts, focusing on coping support, neighborhood connections, and empowerment for an age-friendly community. Evaluation metrics included focusing on emotional wellness indicators such as how depression, loneliness, and stress levels changed due to participation in the program. These examples guide our approach to evaluating the ICSM, emphasizing community engagement, culturally sensitive data collection methods, like surveys and interviews to measure impacts effectively, and a focus on the holistic well-being of ICSM program participants. To establish evaluation methods, the program administration team and I collaboratively developed a logic model. Through a series of in-person and virtual meetings, we identified and mapped out all the resources, inputs, outputs, and desired outcomes associated with the program. This logic model provides a clear and holistic overview that informs our approach to evaluating the program's impacts and outcomes throughout the life cycle. 2 indicator lists were developed specifically for homebound individuals and caregivers to measure the potential, intermediate, and long-term impacts of the ICSM program. For homebound individuals, indicators focus on emotional well-being, community connection, holistic well-being, satisfaction with home-based care, and nutritional health outcomes. For caregivers, indicators include satisfaction with training and support, skill acquisition and confidence, stress reduction, retention rates, employment transition, and self-reported financial stability. These indicators form the basis for data collection tools and procedures for this evaluation. Several methods will be employed to gather data for evaluating the ICSM, including electronic medical reserve, EMR-specific data collection. So homebound program participant consent will be secured to access personal health information for monitoring emergency visits and acute care stays throughout the program. This method entails capturing narrative patient charting, including client intake, nursing interventions, and observations from patient EMR files. Photo voice, a participatory action methodology where participants express their experiences through photography accompanied by narration. This will capture participant interactions and elements of the relationship between homebound persons and their caregivers, offering a visual perspective of ICSM program impacts. Standardized surveys. Developed in collaboration with the Indigenous Caregiver Support Model Administration team, standardized surveys will be administered to gather information on program impacts from the perspective of participants. Conversational method. Grounded in Indigenous knowledge systems, this approach facilitates storytelling and intimate interactions using a semi-structured interview guide. Face-to-face meetings or telephone conversations between the evaluator and participant will enable the co-creation of knowledge naturally through conversation. The recruitment and retention process for the ICSM evaluation focuses on engaging homebound individuals and caregivers. I've created a flowchart seen on the left outlining the recruitment process for evaluation participants, detailing the roles of individuals involved from the LPN team to the research and evaluation team as participants progress through the evaluation. The goal is to recruit at least 2/3 of the 20-person homebound participant population and unknown caregiver pool to ensure representative findings. Recruitment will be led by the clinical resource nurse and licensed practical nurses during check-in meetings, with honorariums offered for participation. The number of caregivers in the program is currently unknown because there is no cap on caregiving participants. As the program evolves, the evaluation team will gain a better understanding of the caregiving population, as there could be a large participant pool, and that's the hope going forward. As for the data analysis methods, quantitative data analysis will use descriptive statistics to summarize the collected data. Descriptive statistics, including frequency distribution tables and percentages, will offer insights into client care and health outcomes throughout the ICSM. Conversational data and photo voice narratives will undergo narrative analysis to interpret the stories and experiences shared by homebound individuals and caregivers in the ICSM, deepening the understanding of the program's impact. Qualitative data and from narrative charting in electronic medical records and survey responses will undergo thematic analysis. Thematic analysis organizes data to identify common features or codes, leading to the emergence of descriptive themes that provide a structured framework for organizing and reporting observations from the ICSM participants. After completing the data collection and analysis, the research and evaluation team will develop a formal report showcasing the evaluation work. This report will include sections covering background, evaluation questions, procedures, data analysis, findings, and conclusions or recommendations. Once drafted, the report will be shared with the ICSM administration team, including the CRN and LPNs, for feedback and recommendations. After revisions and approval, The report will be submitted to key rights holders named on the Fraser Health Project Charter to provide evaluation findings to and support advocacy for the continuation of the ICSM program beyond its initial 3-year pilot timeframe and into an expanse phase across other regions of Fraser Health's catchment. Additionally, a condensed snapshot document of the evaluation report will also be created for ICSM participants, facilitating easier access and comprehension for all of those involved in the program. Thanks for your attention. Before I finish, I just wanted to say a special thank you to my practicum supervisors, Margot and Janice, for being so helpful and supportive throughout my practicum experience. Now I'd be happy to open the floor to any questions or comments that you may have. Thanks.